It's Charter Local Edition. Brad Pomerance here inside the state capitol in Lansing, Michigan. We are joined by Hank Vaupel. He is a member of the Michigan House of Representatives. And Michigan over the last few years has looked at reforming energy policy, trying to look towards avoiding energy waste, looking towards renewables. There is a goal to try to reach, I guess, 15% renewables by 2021. But a lot of that was driven by a federal government in favor of that policy. We have a new federal government. And so where does Michigan go on this question?
Well, that's a good question, because the energy is very complex. It's not just a make it, store it, sell it when it's needed. We can't store electricity, so that creates the problem. The issue was created by the EPA changed their emissions standards for coal-fired plants. And although Michigan's coal-fired plants were in the process of being taken offline because they weren't that efficient, they couldn't meet the standards as in their regular plants.
And Michigan still gets, I think, about 30% of its energy from coal.
It does, yes. And so it created kind of a hurry-up situation where the plants had to be replaced a little bit quicker than they were. So the energy companies are trying to plan on efficiently building plants for what they need.
So does the new administration give Michigan a bit of breathing room on this? Is that what's predicted or anticipated? It's
anticipated that the standards may not be lowered the way that they were supposed to be, but the energy companies have already started in the plans down the road, so they feel that really, even if there's a change, they're far enough down the line on replacing their plants that it won't make a difference.
So what do you make of that? Because look, Michigan, the car capital of the country, has a interesting relationship with the energy industry. We're looking towards better fuel efficiency standards for cars, but yet those standards may drop with the new administration.
Well, I think that probably the new administration, there will be changes in energy plans, but I think at the state level, even with the auto companies, that they are already in progress of trying to meet the standards that they feel will be there, that they have to meet anyway. And I think that they are trying to meet them, the efficiency standards, the environmental standards. The plans are in progress, and so I think even with the change in the federal government, depending on what happens, it may not have that immediate effect on things.
We also look toward the new administration and its desire to change healthcare policy. The incoming administration has been very clear that it's looking to repeal the Affordable Care Act. The challenge for Michigan, as an example, is that before the Affordable Care Act, those 18 to 64, 27% were uninsured. After the Affordable Care Act, 8.6% uninsured. As of today, 1 million Michiganders have insurance as a result of the Affordable Care Act. So Michigan took the Medicaid expansion. 650,000 people are benefiting from the expansion. What is Michigan going to do?
That's good. That is a good question, and part of that will depend on what happens with the Affordable Care Act, and I think that that's a misnomer. It's not as affordable as we had hoped, and that's the situation that is there is healthcare the cost keeps going up.
And you bring up a good point, because look, there's no question that premiums have been increasing at a rate greater than anticipated. In Michigan, the average hike in this last cycle, almost 17%. Insurers are dropping out, doctors are dwindling. Why is that happening? It's hard to know, but again, when you have 1 million people getting insurance through a plan that may be flawed, what is the state to do?
Again, excellent question. I think part of the Affordable Health Care Act was that the insurance companies, the policies offered, had to contain a lot of things, and they were mandated to.
Right.
So that drove up the cost of the policies, obviously, and it took away some of the choice that people had as far as policies having, say, really high deductibles and a lower threshold for them to pay for the.
I think it's fair. Democrats and Republicans would agree the Affordable Care Act needs reform.
Yes.
I think that is agreed across the board. But as a representative of Michigan, are you looking to see a repeal or a massive overhaul? These are uncertain times.
Yeah, I think that that you brought up a good point with the number of people that are now insured, and they should be insured. In this country, we should be able to have health care and of some type. So the key is to try to bring down the cost, or try to control the cost. I don't think bringing down the cost is the thing, because how are you going to dictate that a doctor only makes a certain amount of money? And I think private industry has to do that. I think the healthcare industry and the insurance industry have to come together, because we are reaching a crisis. And I think healthcare, the cost of healthcare, is a major crisis.
And by the way, I'm speaking with a doctor. I mean, you are a veterinarian.
Correct.
You may be serving, animals, but you know from what you speak.
We're all affected by the cost of health care, and government controls, I don't believe, have ever done any good. So I think we have to get private industry to help with these solutions. And from my point of view, it's eliminating some of the childhood diseases, some of the neonatal diseases, some of the very expensive chronic diseases that we're
eliminating,
faced with.
meaning for research?
No, meaning curtailing some of these diseases that we now have that are so costly. Things like fetal alcohol syndrome. That's controllable by that. And that just eliminating so many people that are affected by it would drive down the overall cost.
And that brings out an excellent point, because those that suffer from fetal alcohol syndrome, their mothers are often impoverished.
Yes.
But some of those mothers did benefit from the Medicaid expansion.
Absolutely.
And so if all of a sudden they're off of Medicaid because the expansion was eliminated, we can start seeing spikes in fetal alcohol syndrome. So my question becomes, let us presume that we see a block grant program. That's what we've heard from the Trump administration as an example. Have you started to speak with your colleagues about how to fill the gap if the expansion is eliminated?
I think that there is work going on to try to fill the gap, because I'm not suggesting that people go off or that we kick people off, but we should have insurance. Everybody should have health care in this country, at least. And so the key is to try to, I think, decrease the overall cost, and not maybe the individual cost. As I say, telling doctors what they can make, even trying to control drug companies as to what they can charge. I think a little transparency in the healthcare industry would go a long, long way.
And we've heard that from the incoming administration, maybe allowing the sale of insurance across state lines. That could bring down some cost.
That would help, and I think people knowing what they're paying for healthcare costs, because at this point we don't. And if you try to find out what a procedure is going to cost, if you're going into a hospital and find out what the procedure is going to cost, I don't think that you can.
He is Dr. Hank Vaupel. My name is Brad Pomerance. We are coming to you from the Michigan State Capitol in Lansing. My name is Brad Pomerance. Again, you're watching Charter Local Edition.